I just wanted to announce that we have nothing to announce and have a very good day. No, in all seriousness, I appreciate taking the time to meet with us today, and of course we're here to discuss with you all today the House proposed sub-bill for the biennial budget, the governor's proposal. And I'm going to turn it over very quickly to Chairman Smith to get into the details and the weeds of the budget. But before I go further, I publicly want to be able to take the opportunity to thank all the hard-working staff that's put the time and efforts into this budget. And on top of that, all of Chairman Smith's effort and his staff and our subcommittee chairmen, like Subcommittee Chairman Sprague, Chairman Thompson, Chairman Chairman Duffy, Chairwoman Grossman, and Chairman Cupp. They did an excellent job, and what I think has crafted an excellent budget to go forward through this process. Overall, on the tax provisions, I want to just say, look, I believe in what the governor's trying to do and where he's trying to go long term with our state, and trying to look at a new fiscal policy for our state, especially on the tax atmosphere. And what I want to do is continue that ability and continue what I think is a pretty good glide scope that we're on right now, on a glide path onward to ascend. And so what we're going to recommend is, as we continue to go forward, is to pull out the provisions that the governor is recommending in his tax plan, and instead instigate a 2020 tax commission that is going to be comprised of members of the Senate, members of the House, the governor's tax commissioner, and governor's budget director, so that we can have a long-term discussion on how we can help the governor really get there in a long-term scope, bringing all those parties and the businesses to the table to have a discussion, so that, one, businesses have the ability to have some predictability, to be able to prepare into the future of what kind of our glide path will be in the future with tax policy, and also come into some kind of tangible effort that will get everybody on the same page and on board, just as the legislature did with Governor Taft when they had the 21% reduction over 5 years occur. They had a lot of people on board. So what we've done is, in the tax arena overall, is a $1.2 billion tax relief to Ohioans over 2 years. It's a 6.3% across-the-board income tax cut beginning in FY16. It lowers the top rate below 5%, and we make the 75% small business tax deduction permanent. And I think this is a huge step in the right direction, not only for Ohio, but for all Ohioans, and most importantly for those small businesses in Ohio. In primary and secondary education, as I said, Chairman Smith will get into the details, but for the most part, we're maintaining the governor's footprint of the executive K-12 funding proposal, including additional $179 million into the foundation formula and the executive proposal into the future, and increasing a total increase of $850 million in state aid from 15 to 17, and ensuring that no district will receive less foundation formula than 16 or 17 than that in FY15. In healthcare, you're going to see, and this is the reason why we got Chairman Sprague here as well, we had a great subcommittee team that heard from a lot of impassioned folks. Our number one concern and goal is to continue to remember this is not about expansion. We're talking about reauthorization, and how do we continue to put this program in a way that helps look at implementing cost transparency measures. We're going to require that the Department of Medicaid seek waivers to allow for health savings accounts and work requirements. We're going to have a report that goes out to currently study what we currently have in place, and we're going to return Medicaid eligibility determinations to the General Assembly. So these are some of the big points that we're talking about in this budget as we continue to go forward from our sub-bill. And I want to take the opportunity again to thank all those who worked really hard. Again, I want to repeat this because it's important. We're not at difference with the governor. We are in a position to say we want to help continue to work on this and craft this in a way. There's also several areas in the Medicaid portion that we're splitting out to run parallel to give it some more time and effort. There's some areas in education that you're going to see that we're doing to also do the same. And then further into the future, you'll see as we continue to craft this, a joint educational oversight committee that will be able to do the same perfunctory roles as the JMOC committee currently does with Medicaid, but with education, so that we can continue to study it and look at the funding formula into the future. So with that, let me turn this over to Chairman Smith, because I know we don't have a lot of time to be with you, and we want to take questions on some of the major details of the budget.
Thank you, Speaker. He kind of hit on all the highlights. I'm going to touch on just a few of the points as far as tax reform, Medicaid, K-12 funding, and a few other pieces as we go through. As the speaker mentioned, our caucus set out to really try to dig into the tax reform side, do something meaningful, and this budget will provide a $1.2 billion tax relief for Ohioans over the next 2 years. Under substitute House Bill 64, there's an across-the-board tax cut of 6.3%. That lowers the top rate to under 5%. It also took the small business pass-through deduction from 75% temporary and made it permanent. That's something I think in the last General Assembly we felt like did a lot of good. We got a lot of positive feedback. It's relatively simple and clean, and again, got a lot of good feedback from the small business owners that was very helpful. And we think this will allow them to keep more of their hard-earned money and invest it back into their businesses so they can create more jobs for Ohio's future. A few other significant tax changes, as the speaker mentioned, we did remove the sales tax, the increase, the expansion, the severance tax, cigarette tax, and the commercial activity tax. We did keep one piece, which was the means testing for retirement income credits, and basically that's for retirees with incomes of over $100,000 would no longer be eligible to receive a $50 senior tax credit, a deduction of Social Security income, or the retirement income credit. But I want to make it clear, seniors with incomes below $100,000 remain unaffected. We also, throughout all this tax discussion, there was a lot of great ideas that came forward, and in order to really give it more process and thought, we came up with the idea to create an Ohio 2020 Tax Policy Study Commission to take a larger, more comprehensive look on where we go in the future as far as our possibility of other tax provisions we could look at and how it would impact Ohio. We took the step to eliminate a political contribution tax credit of $50 per person or $100 per joint filer, and we chose to utilize that to fund a line item of co-ops and internships because we feel like it's important to give the students that opportunity. So that kind of touches on the tax piece. Moving on to transforming the healthcare and Medicaid. Again, we shared a common goal with the governor to help those who need it most and have taken steps to achieve that. We shared, we should focus our resources on those who need to help overcome their personal challenges and help lift them up and off government assistance into a better way of life. In testimony, we heard a tremendous amount about developmental disabilities and 3 or 4 different areas in that space, and that's one area that I think we all agree on, that taking care of our most vulnerable citizens is of utmost importance to our members. Starting with that, we did implement language in this substitute bill, which is an agreed upon language between the intermediate care facilities and the administration to make sure that these folks still had options in order to receive waivers for community-based care. We also chose to remove the independent provider piece because we felt like it needed more work. It's something that is incredibly complicated, with the Department of Labor recently becoming involved in that, and we just feel like it's something we could do more work on and make sure that we ensure that the independent providers can continue to take care of the most vulnerable in the best way possible in their homes. And then we also specified that it is the General Assembly's intent for individuals served by workshops to be informed of their decisions and also continue to receive services in a variety of settings. And the last piece in the DD space was create a Developmental Disability Closure Committee to provide a process to review the proposed closure of any state developmental center. Moving on to the drug epidemic, which Representative Sprague and myself have really focused on over the last General Assembly. We heard a lot of testimony as far as our drug courts that we've used medically assisted treatment involved in. We actually funded those to the extent of $4.5 million a year to add an additional 15 counties to that particular program, and we're very excited to see where that will go. We also earmarked $500,000 from community innovations to improve county access to naloxone, an opiate drug that reverses the effects of an overdose. We provided $5 million per year to expand the creation of specialized drug courts. Again, another successful program. As far as one just quick piece on the caring for seniors, we dictate that Passport covers consultation and assessment services provided by an RN at the same rate as the home care waiver program. Moving on to nursing homes real quickly, there's $84 million in quality measures for nursing homes to help incentivize and ensure that we have quality care and continue to help our nursing homes and incentivize the correct care. We've talked a lot about person-centered case management, and in this executive version was a piece that tried to conceptually we really like. We like the idea of trying to target this group of 16 to 24, doing some very person-centered case management. What we've decided to do was require all counties to create a Healthier Buckeye Council, and that council will it'll promote opportunities for individuals and promote and achieve optimum health. So this is our how do we get folks in the 500,000 in the Group A population up and off the system, to really dig into what their problem is and try to help them. That's something we're going to continue to work on outside of the budget in a separate bill through this Healthier Buckeye proposal that Representative Amstutz and Representative Derrickson will head up. We're excited to see where that might go. We also did an increase in the Medicaid dental reimbursement rates for Appalachian counties. There's 17 counties, and we're trying to improve access in an underserved area in this particular one. Other significant changes I would mention with the Medicaid piece, as the speaker mentioned. This is something that we've tried to put some reforms on to create a more sustainable pathway for us going forward. And Representative Sprague and his subcommittee have worked tremendously hard on this particular area and done some great work. What we are introducing, as the speaker mentioned, a health savings account that we would like Director McCarthy to apply for a waiver for. This is goes hand in glove with the price transparency, so people can now make better informed decisions and understand the cost differences from a visit to the ER versus a visit to urgent care, or just how much everything costs when they have certain things done. I think that's extremely important, trying to get our arms around overall healthcare costs as it is. We provide an additional $2.75 million a year for Ohio food banks. We put $500,000 a year in additional money for rape crisis centers. We create the health food financing initiatives to support access to healthy foods in underserved areas. And we maintain TANF funding for Ohio pregnancy and parenting support programs. That's just a few pieces on the health side. Moving ahead now to primary and secondary education. Our main goal here, if you look at Ohio Department of Education, they have 8 typology groups. And if you break it down on an expenditure per pupil in each typology, you can see a vast difference from wealthy suburbans to maybe poor rural areas, or even small town rural areas. What we're trying to do is bring the bottom level up. We want to ensure that every child, basically we're providing core funding level to allow all schools to be competitive. That is the thrust behind this. We don't have any thought of this ever being equal in the expenditure per pupil. I don't expect it to be even, but I do expect it to be adequate. And I think that's the goal behind this. This does include $179 million in additional money to the foundation formula. We maintain a lot of the principles that the governor had in the K-12 funding proposal that he had. We did make several revisions, one of which is we restore the 20 mil charge-off. This is an expected local contribution, so the charge-off helps direct resources to lower wealth districts. We're kind of changing the distribution when you look at the per pupil expenditure and raise the lower piece, like I mentioned, and distribute it a little bit more equitably across that group. We also phase in a guarantee that no district will receive less per pupil than is provided through state resources to private schools. So this only affects a small number of districts. I believe it's 28, but the 28 that are below what's just under the $1,200 per pupil number will phase this in. So the first budget will get them halfway to that 1,200 mark, and with the idea that we'll hopefully be able to complete that in the future and get them up to a minimum fair funding level. We also, and this kind of gets into higher ed, but we doubled the college credit earmark and foundation funding as well. Just a few high spots on a few other areas. We require all colleges participating in College Credit Plus program to offer an associate degree pathway. This would allow high school students to participate in College Credit Plus programs to graduate high school with an associate's degree for those that offer that. It also increases the funding to the Ohio College Opportunity Grant, or OCOG, by $5 million per year. We've heard a lot of testimony how that important that was to a lot of students. A few other significant items that maybe aren't quite as related, but one I think is important. It works to implement a strategic plan to focus university strengths for support future missions for Wright-Patterson Air Force Base and NASA Glenn Research Center. We increased the public library funds 1.66 to 1.7% of GRF. We increased. We put $12 million in the Indigent Defense Fund for the local government. Did a fair amount of things for veterans. I'll just mention one. We earmarked $750,000 for the Ohio League Aid Fund per year to help provide representation for economically disadvantaged veterans. And I could keep going, but I'm sure there's probably a few questions that people have to ask. So.
The other thing is, what I want to talk about is, as you all know, the House's main priority has been on this issue called the 2020 thought process, that we're trying to move towards thinking into the future. So beyond the fact of having the Ohio 2020 Tax Policy Study Committee, which will again help the governor aid in his efforts to try to formulate and focus on where we should go in the future for our state on our tax policy and give more input and insight, we're also doing, as I said, the Education Study Committee, the Joint Educational Oversight Committee, a Grace Commission that will review each line item to see where mergers can continue to happen to save monies, and JMOC is going to be directed in both the Grace Commission and JMOC's request to look at Medicaid line items to see where there's redundancies, to where there's programs that we're also paying for that Medicaid currently covers, to take a look at those and make recommendations by the end of the year for those things to be pulled out. So those are some areas that we're also have been looking at, and definitely looking into the future as we continue this budget process along with other things. I want to quickly, before we do questions, again see if Chairman Sprague has anything to add on the Health and Human Services item, and ask Representative Amstutz to quickly talk about Healthier Buckeye.
Thank you, Mr. Speaker. I guess the first thing I would add is just that I think that with regards to the Medicaid expansion, there's a realization that in order to make this program sustainable over the long term for the state of Ohio, we have to have some dramatic reforms to the system. And some of those reforms have already been talked about. The price transparency piece. We have to know what hospitals and other providers are actually charging you when you walk in the door to get a procedure. That helps everybody, not just our Medicaid system, but every consumer in the state of Ohio. It's about time that we know what those prices are as a state and as citizens of our state. The second piece is the health savings account, which obviously makes people on Medicaid, in addition to everybody here in the room who probably has a commercial plan or a health savings account. So now everybody has skin in the game. So now you have a reason to pay attention to the prices and hopefully choose that lowest cost option. But the third piece is, with the Medicaid expansion, we now have able-bodied adults without children that in some cases are beginning to crowd out what we would call our traditional responsibilities of the Medicaid system. Individuals that have developmental disabilities and others, children. And we need to make sure that if you're an able-bodied adult, that although there's a time that you might spend on the Medicaid system or on our food stamp assistance program, that you go back to work, that you get back into the workforce. I think as Ohioans, the one thing that we've been always known for in the United States is our ability to work. And so we are looking at pursuing a work requirement for the SNAP and the food stamp programs as we go forward as part of our longer look at the Job and Family Services case management piece.
Ron, we're going to cover Healthier Buckeye.
Well, building on what Chairman Sprague just said, the idea of helping our communities at the community level to wrap around those who are looking to improve their situation to the point where they don't need Medicaid or they don't need other forms of public assistance is a very big project. but we see the administration's budget proposal having a real focus on intensively working, mentoring with, and case managing individuals who are in that mode. And we like that to the point where we want to build on some things that we've passed in previous legislation by amplifying and more specifically requiring activity at the local level that's focused on the whole needs of individuals, and those are going to have to be customized in order to make them work for individuals and their families. And maybe there'll be some questions on that, but we have put in our bill that we're bringing out today some amplification that is this Healthier Buckeye program deployed at the local level, but also deployed with some resources that have not been available up till now either, that we are seeding a major fund that will be available to those who already demonstrated, in many cases, effectiveness, but need amplification to reach more people. And also to help our local county level or multi-county Healthier Buckeye councils that are going to be formed as this year goes forward to get engaged and to be successful. So that's a little bit about what we're trying to do. The administration has proposed a series of case management steps that need more work because they haven't yet had, I don't think, enough collaboration with the folks that are going to be down on the ground making this happen. So we're going to create a process in a separate bill that the Speaker alluded to that I'll be helping to carry in addition to the language that we have in the budget, so that we will try to work that towards a conference committee further mature set of plans. And we look forward to working with the administration, the Senate, and outside parties who have a direct stake in trying to help our state become a stronger place for more of our citizens.